Thank you all so much for coming on the call. We really appreciate the fact that you would take some time out of your day to hear about valuable information that can positively impact the African American community. We've heard about everything that has been going on, and we certainly do not want a situation where we don't mitigate, where we're not wise about how to approach this. And with that being said, I'm going to go ahead and introduce our chairwoman to the call. It is 2 o'clock. Chairwoman Angela Turner Ford, are you on?
Yes, I am, Representative Hudson. Thank you. Thank you. I appreciate everyone for coming on the call this afternoon. We've put together a session for us that we're going to call our digital dialogue with the Mississippi Legislative Black Caucus. I still hear attendees getting on the call. What's important for us today is to make sure that we create a format where we can inform our constituents, where we can reach out to members of the community that are responsible for our health, responsible for our government, and to provide us information regarding finances. And we've lined up a panel of participants today, and I believe that they're going to share vital information to you, for you, information that you can use. And just to tell you a little bit about the Mississippi Legislative Black Caucus, our group consists of 55 African American members of the Mississippi Senate and the Mississippi State House of Representatives. And we take it as a charge to have a pulse for what's going on in the community. We are on the front lines of government, and we want to do all that we can to help you. So as we get prepared to bring on our first guest, you'll be hearing from the State Health Officer, Dr. Thomas Dobbs III. He is on the front line. He's been in the media providing us with various reports. If you would please give him your undivided attention, we will now hear from Dr. Thomas Dobbs. Welcome, Dr. Dobbs.
Thank you so much. Well, hold on. I'm not sure I'm not muted. Can y'all hear me?
I can hear you, yes.
Okay, great. Sorry about that delay. Hey, so thank you so much for having me, and I'm really excited about the opportunity to kind of go over some of the latest issues going on with coronavirus, what we're looking at as far as like what we can expect for the next couple of weeks. Talk a lot about this really horrible impact in the Black community and talk about what we can do about it. And I think you guys probably know a lot of this information, but just to give everybody sort of foundational sort of start for our conversation is, what is COVID-19 or the coronavirus? And basically it's a virus. It causes a flu-like illness. The symptoms are pretty much identical, although there's some variability in what it is. It will typically cause a febrile illness with maybe some cough and congestion. And most people will get over it just fine. Probably 99.8% of people will recover at some point. Probably 80% of people have a very minimum amount of disease. And then that maybe 20% of folks have moderate disease. But the scary thing about it is that when people who are vulnerable, especially people who have chronic underlying medical issues or maybe mortality rate, and that's where we see most of our deaths. And I'll talk about that in a little bit. As far as how does it spread from person to person, it's spread in a lot of ways very similar to influenza. So basically, if someone has the virus, they will cough and sneeze, and maybe sneeze into the air and somebody breathes it in, or it gets on their eye or something, or they can contaminate like a table or some environmental object that people are around, and then another person can touch it and sort of contaminate their face, and then they would get sick. And so that's one of the reasons why we have a lot of these aggressive social distancing that has been implemented to try to keep people away from one another as much as we can so that they wouldn't come in contact with it. And obviously some of the more basic foundational things that we can do as far as like hand hygiene, making sure you're washing our hands frequently, making sure that we hand sanitizer, and then also, covering up when we cough and sneeze, that we can do is make sure that if we're sick, if there's something wrong with us, then we go ahead, stay home from work, or don't go to school. But obviously, there's not a lot of school going on right now, which obviously that's all been kind of backed off. So as far as like who gets the virus and who spreads it, One of the things that's been really sinister about how this virus works is it doesn't make young people very sick, or it makes them sick in a way that's not really dramatic. And so they can get it and they can spread it around and not be a big deal. But if the young folks take it to their family members who are maybe older, maybe have heart disease or something like that, and then they get it, then we see a lot of severe illness with like people having to go in the ICU, having to go on ventilators, and then obviously people are gonna die. If we look at what's been happening in Mississippi, we are now at a pretty significant case rate. We're looking at 2003 cases with 67 deaths, and we also have it impacting 41 different nursing homes or long-term care centers around the state. If we look at the people who have gotten the virus, a remarkable 56% of African Americans have, or of all the cases, 56% of folks are African Americans. That's remarkable. That the case rate is going to be about double what it is for white folks. And my suspicion is because of lack of healthcare access for a whole host of reasons, that probably Black individuals, their rate's actually higher. We just don't see it as much. And then even more alarming, we see that the death rate. So the percentage of the deaths that we've seen in Mississippi, 72% have been Black and 28% white. So it's been a whopping lopsided mortality when we look in African American folks. It's hard to know exactly why that is. This has been something that's identified across the country. Certainly other places have been looking very closely at this, especially Milwaukee, and that's a good model for people to read about if they want to understand some of the underlying conditions that people think are driving it. But certainly at least one of the conditions that's driving it in Mississippi is comorbidities or other severe medical issues. If we look at the amount of people who have died in Mississippi, and we compare Black folks with white folks, the Black folks have a lot higher rate of hypertension, have a much higher rate of immunocompromised conditions. Cardiovascular disease is much higher, lung disease, and diabetes is like about, it looks like it's about 7 times higher in African Americans than in white folks. And also renal disease about twice as high. So one of the things that's clearly driving, at least one factor as far as like the mortality rate, is going to be the fact that these long-standing health disparities are driving the mortality. But that doesn't really explain the infection rate, right? This is just the folks who died, not the people who are infected. So there's a lot more going on that's making it more likely for Black people to get infected with it in the first place. If we look at the whole population and look at who's dying, it's mostly going to be older individuals. Ages of 60 and over 90, that's going to account for about 90% of our deaths, or even 95%. So the vast majority of our deaths are going to be caused in older folks. We do have 5 deaths in the age group of 50 to 59, and every single one of those deaths is African American. Again, consistent with our concerns we've identified before. If we look at kids, we see that children actually do quite well. We've had only a small number of kids. We only identified 11 cases in children 1 to 5, 11 cases 6 to 10, and 29 cases in those who were basically teenagers. A lot more kids have almost certainly been infected, but we talked about, they don't get much symptoms. And so they're probably having a lot more infected, but they weren't sick enough even to warrant testing. And if we look at the ages of hospitalized folks, the most common age group is going to be 60 to 69. Again, older folks, older age group. Rate, so of people who've been diagnosed with COVID, about a third, or 29.6%, end up being hospitalized, which is going to be one of the highest. It kind of varies, or the highest rate in the country as far as hospitalizations go. So what do we need to do as a community at this point as far as trying to prevent transmission of COVID? A lot of things have happened as far as social distancing, right? So we implemented recommendations to stay at groups of 10 or more. We The schools have been closed. Most non-essential businesses have been shut down for now, so that people aren't exposing one another. We worked with health systems to minimize unnecessary clinic visits and procedures so that people aren't exposed, but also to preserve some of our very important PPE. But the other thing is testing. We need to test as many people as we can. I know it's hard to believe that Mississippi might do something good, but we've done well over 20,000. It's actually going to be a lot more than this when we update it. 20,000 tests for COVID-19 in Mississippi, and we need to do a lot more. Per capita, it's actually going to be one of the higher ones in the country. Their public health lab started very early doing tests. We've also had doctors doing a lot of tests through the private facilities, especially there's a lab in Memphis called the AEL that's done a large number of them. As far as getting the test, there are a lot of places that you can go to get tested for COVID if you have the symptoms. You can go to our website at healthyms.com/COVID-19, and we have a list of all the clinics that advertise that they'll test for COVID, and there's just well over 100 of them. But in addition to that, and certainly very appreciative of the community health centers, all the community health centers are offering COVID testing, and I really greatly appreciate their leadership when it comes to the coronavirus. In addition, the Department of Health, in partnership with UMC and support by National Guard, has been doing these mobile testing sites in different areas that maybe have underrepresentation as far as testing goes. Maybe they're geographically isolated or there's no one there testing. So we've done about a dozen of those so far. We've got several coming up this week. And then I'll talk a little bit more about some of our plans going forward that will help maybe look at African-American disparity, trying to identify people a little bit more aggressively. But as far as messaging, and I hope these are some of the things that you could share with your constituents and people that you think can get the word out. We really need to do everything we can as an individual, as a family, as a community to make sure we prevent this transmission. Protect yourself, follow the rules, stay away from others if you can, as much as you can. Protect your family. Stay home for the people you love. One of the real problems is, and we've seen this not just in Mississippi, but other places, is that either young folks who have mild or no symptoms will give it to older folks or people with chronic medical conditions, and then they have a really bad outcome. Another scary thing is before people even start having symptoms, they can be contagious. They're probably not as contagious as others, but they can be contagious. And so for that reason, we actually strongly recommend staying away from your older relatives, even if you're not sick, because you really don't know if you might be contagious and then can spread it to somebody you love, and then something bad happens. Us all collectively following these recommendations, we can shut the transmission down in the neighborhoods and the communities in which we live, and then we can maybe get back to normalcy a little bit quicker. So just some, within that vein, just some basic things that will help everyone. Stay home and away from others unless absolutely necessary. This is a walking trail or just around your neighborhood. You need a little sun, a little bit of exercise, that's fine, but just stay away from folks. We really need to avoid human contact as much as we can. When you're out in public, we do recommend wearing a mask if you're around other folks, especially when you're going somewhere like a grocery store or somewhere where you're obtaining essential supplies and there's other people around. You can't know who has COVID. Someone who is perfectly asymptomatic seeming, someone who's not coughing or sneezing could very likely have this disease and give it to you, and then you can give it to your family, you can give it to other people, you can bring it in the community. So it's very important to make sure that we're in public, we take all necessary precautions, including hand hygiene, going out as infrequently as possible, right? Not go to the store every day, but maybe once a week or something like that. One of the most important things is to avoid public gatherings of all types. And this is where we've seen a lot of outbreaks. We never want for folks to get together in groups of 10 or more, but whenever you are around other people, always maintain a distance of greater than 6 feet at all times. These gatherings include funerals, family gatherings. in-person church services, weddings, or any other type of social gathering. These are mechanisms that we've seen pretty remarkable spread of COVID within certain communities because people were loving one another. And it seems really cruel that showing your love for somebody, especially at a funeral or church or wedding, ends up being a mechanism for this sinister virus to spread within the community. And within that same vein, it's important to not see new people as much as you can, right? So if you and your family of say 5 see each other all the time, you're at home, you know, that's understandable. You got to do that. You want to see the folks that you're around. What we don't want to do is introduce new people into that group of folks. You don't want a neighbor coming over to have coffee, right? And that neighbor maybe had been with another neighbor and then bring it into your pod, your family. So please avoid new folks as much as you can. And then if you do think you have COVID, or if you're sick and have flu symptoms or have fever and just don't feel good, please get tested. Call your physician or practitioner if you think you might have it and get tested. Go to the website if you want to see where testing is offered. Also, look for a mobile site if there's one, or strongly encourage you to contact your community health center. I know they've really done a fantastic job. And as far as from the Department of Health response in this bad disparity in COVID in Black people, we are organizing a multi-pronged approach. And I know we've talked about this a lot in some previous calls, but Dr. Victor Sutton from our Community Engagement Center at the Department of Health is leading the charge with my support and other people at the agency to make sure that we do media outreach, PSAs, working with HBCUs to get the word out, proper messaging, engagement with faith community, with political leaders at every level, state and federal. So expect to see a lot of stuff happening. We all need to use our voice to make sure we get these messages out, because we're already knee deep in it. The cat's already out of the bag in some respects, but if we really want to stop it where it is right now, we've got to take these aggressive steps to make sure that we protect the communities and the people that we love. And thank you, Senator. That's all I have.
Thank you, Dr. Dobbs. I was having a little problem locating my mouse on the computer. We thank you for your comments today. We thank you for spending time with us and sharing information for each of us to take and distribute into our communities. At this time, we will move forward with our next presenter, Dr. Sandra Carr Melvin. She's the health chair for the Mississippi State Conference of the NAACP. Dr. Melvin, I will unmute you now. Can you hear me, Dr. Melvin?
I can hear you. Good
Okay.
evening, good afternoon, everyone.
Good afternoon.
To the distinguished members of the Mississippi Legislative Black Caucus, thank you for inviting me to participate in this very important dialogue about COVID-19 and African American community. In January 2020, the United States was confronted with an invisible threat, unlike any other that we have seen in most of our lifetimes, COVID-19. COVID-19 is an effective, deadly pathogen and extremely contagious. What we do know today is that over 400,000 people in the United States have been infected with COVID-19, and over 14,000 people have died. That number does not take into account the number of people who did not go to the doctor, or the people who died from complications of COVID-19 that were unrecognized at the time of death. COVID-19 has affected all communities, regardless of race, socioeconomic status, and political affiliation. However, as with most diseases in the United States, minority, poor, and underserved communities have been affected at a disproportionate rate. This trend has been observed nationwide and has also been demonstrated to be the case here in Mississippi. And that's what I want to focus on today. What we know today and every day, this is a very fluid situation. The numbers change. As of this morning, it was reported on the Department of Health's website that 2,260 cases of COVID-19 have been identified and 76 people have died. And what is startling is that 71% of those deaths are among African Americans and 52% of the people who are infected with COVID-19 are African American. And this is troubling, but it's not surprising given the fact that African Americans living in Mississippi have higher rates of diabetes, obesity, and cardiovascular disease. And these have all been demonstrated to be factors that make the progression of the disease worse and the outcome worse. And in Mississippi, we know that 46% of African Americans have hypertension compared to 38% of whites. 46% of Blacks were obese compared to 36% of whites. 16.1% of African Americans were diabetic compared to 13% of whites. And in fact, the data released by the Department of Health has also shown that the rates of diabetes, cardiovascular disease, and hypertension were higher among those African Americans that died because of COVID-19. Unemployment and elevated poverty levels are also barriers to accessing health services, which can lead to unmet needs, delays in receiving appropriate care, inability to get preventative services, and hospitalizations that could have prevented the progression of the disease. And so what we do know is that within this state, 19.7% of the population lives below the poverty level. And if I break that down by race, 30.7% of those living below the poverty level in this state are African American compared to 12.3% of whites. Lack of insurance or being underinsured is another factor that can drive trends related to the COVID-19 pandemic in Mississippi. 12.1% of Mississippians are uninsured. And again, if we break that down by race, 13.9% of people without insurance in Mississippi are African American compared to 10.6% of whites. The other issue is access to care in terms of healthcare provider availability. Mississippi is one of the country's most rural states, with 79% of the counties classified as rural. 84% of the single county primary care healthcare provider shortage areas are designated within these rural areas. And this is particularly important when we know part of I've had a technical difficulty, I'm sorry. This is particularly important when we note that part of the solution to addressing COVID-19 is telling people to contact their primary care provider if they experience symptoms. So what happens to these populations if there is no primary health care provider in their area? Finally, another consideration for what we see happening in the African American community is that many of the frontline workers that are not being included in the essential category for testing and protective equipment are those grocery store workers, postal workers, sanitation workers. And these occupations also place these workers at increased risk for obtaining COVID-19 and transmitting it to others. So some of the things we wanted to do, we've had meetings with several faith-based organizations around the state and other community-based organizations. And because we know that social determinants of health and comorbidities place a person at significantly higher risk of death from COVID-19, it is absolutely crucial that we act now to develop a targeted solution to ensure that testing and screening efforts are intentional in identifying the illness within the communities that are at highest risk. However, there are some challenges that we will need to overcome to ensure that the response to COVID-19 pandemic is equitable. And some of those challenges are, there is a concern that complete demographics on the Department of Health's website be available to the public. And this is important to developing a complete profile of the individuals at risk. And that includes the geographic hotspots. And in these hotspots, we need to develop targeted and tailored control efforts to meet the needs of the specific community. The second challenge, the testing strategy needs to be improved, especially for those with comorbidities, or at the very least, there needs to be an explanation for why it's not evolving. As of right now, we're still telling individuals if they have symptoms, slight symptoms, to go home, but we're not taking into account the severity of the illness based on maybe some comorbidities that the individuals currently have. Third challenge, there needs to be more diversity on the pandemic response task force. Groups that work with underserved populations need to be included in the emergency response planning process and enlisted to help reach these disadvantaged and marginalized communities. The fourth challenge, given the unique challenges for rural communities, which is exacerbated by healthcare provider shortages and closure of rural hospitals, monitoring and control plans also need to be developed to ensure that the true magnitude of illness and death in these communities are also captured. Specifically, solutions that take into account the rural nature of many of Mississippi's counties, as well as the social determinants of health, need to be developed. The infrastructure of these communities need to be enhanced to include provisions to improve screenings for these disadvantaged minority communities. We also need to redefine the word essential. For example, how does the current plan account for those individuals that cannot practice social distancing? Grocery stores, postal workers, sanitation workers. These groups are not being prioritized for the receipt of personal protective equipment, and this plan needs to include the strategies for protecting these individuals who can also be infected by COVID-19 and continue to spread the disease in the process of their everyday work. And finally, just looking at other communities that may also transmit the disease that need to be considered in any plans, we need to find out what the plan is for also undocumented individuals. They can also become infected and they can also spread the disease. So in our view, a lot needs to be done in terms of creating a plan that takes into account these issues to ensure that the testing, the screening, treatment, and prevention processes are delivered in an equitable fashion to all parts of our society here in Mississippi. Thank you, Senator Ford. I turn it back over.
Thank you, Dr. Melvin. We really appreciate the insight that you provided to us and your presentation today. And we've been taking copious notes, and we know that we can contact you for follow-up. At this time, we'll move forward in our presentations, starting with Ms. Janice Sherman. She's one of our guest panelists today. She is the CEO of Community Health Center Association of Mississippi. Ms. Sherman, welcome to the call.
Thank you, Senator Turner Ford, and thank you and Senators Horhn and the caucus overall for having us on the panel today. Really appreciate it. Community health centers, as some of you know, because you've been huge advocates, were created to really remove part of what we just heard from Dr. Melvin in the way of financial barriers for folks to access healthcare. Have been around for more than 50 years, actually started here in Mississippi, and I'll let John Fairman talk to you a little bit more about that. But we are in practically every county in the state. We see all persons, regardless of their ability to pay, based on what's called a sliding fee scale. We see large numbers of poor, minority, and underserved populations, including migrants and Latinos and people of color, African Americans, you name it. We also are 78% rural, given that we're in Mississippi. We have 240 sites that are across the state, statewide, and see on average about 300,000 individuals per year. What I would like to do is defer to our colleagues in the field who will share their perspective on what's happening locally, and I'll stop there given the time limit for that. But what I would like to do is just invite folks to look at the website for the state association. We are at chcams.org. There's a map there that really depicts every location where there's a community health center in the state, and the opportunity where there's not, where those could be developed. So thank you again for having us, and I'll defer back to the speaker.
Thank you, Ms. Sherman. Do you mind repeating that web address that you just shared with us?
Not at all. The web address for the Community Health Center Association of Mississippi is chcams.org. and our COVID-19 responses there, as well as other information.
Thank you. Thank you, Ms. Sherman. We appreciate you joining us today. Next, we'll move to Ms. Aurelia Jones-Taylor. She is the CEO of the Aaron E. Henry Community Health Services Center in Clarksdale. Thank you, Ms. Taylor, for joining us.
Thank you, and thank you for inviting us to speak on this this pandemic that's taking over our lives here in the Mississippi Delta. I was asked to talk about the local landscape and what's going on here in our community. We serve actually 6 counties in the northwest corner of the state. We are flooded with calls every day about how they can be tested, asking to be screened and tested, and mainly because we are listed as a testing site for on the Mississippi State Department of Health website. We appreciate that. However, as we try to meet the needs of our local community, we're finding that we really don't have the testing supplies that we need or the PPE that we need in order to meet all of the demands. Because as you say, some people may not be exhibiting any kind of signs and symptoms, but they may be carriers, and they may have been in contact with someone who may be carriers. So we're struggling with some of that, and we're looking for more coordination around that response and actually having something as simple as the gowns. We see in our community, people that we talk to, there's a lack of knowledge about how to deploy the protective measures. That is the hand washing and the social distances. We see people walking around with masks and gloves on, but they really don't know how to use them and when to use them. They're sprayed disinfectant. They're buying it out and they're just spraying it around in the air. A lot of wasted resources because people don't really understand how and when to use certain protective measures. Another thing is that there's a reliance on inaccurate and miseducation from social media and relatives on how to cure the virus. We've heard a lot of strange things. People have called in and asked our providers, will that work? And then there's the young invincibles that you've heard about so much, that generation of people who are not convinced that they are danger to others or in danger themselves. So they continue to gather in house parties or socialize in groups on the corner, therefore putting themselves and others at jeopardy, which is why we need to have the ability to do more testing. While my providers, my whole staff all over the 6 counties are ready and willing to do drive-through testing, we can't do anything until we get the appropriate PPE. When we're talking about staff, that's another issue where our staff are very afraid of this disease because they're seeing it on TV every day. People are dying. They're afraid to bring it home for their children, so we're having to deal with that. But by far and wide, our staff are ready to really get going. Then we talk about our belief system. A lot of the people who call in to us are people who perhaps have gone to the church where the bishop was recognized as, where there's this hot spot, this church, and these bishops was recognized as a carrier, and now they want to be tested. We get from our lab 20 tests. That won't go very far. We try to order tests. They don't come because they're going to New York or they're going to someone else. We tried to get the 15-minute test, and it was said to us that this test has not been approved by the FDA. So we have so many barriers and blocks to testing, and we see that as the main way to really allay the fears of our community, but that we need to get ramped up. I agree, it needs to be ramped up. So in terms of transportation is an issue. Rural hospitals that have closed, anybody in the Mississippi Delta has to drive a long way to get. If someone was to be having to be on a ventilator or something like that, I don't know that our hospital will be able to really care for those people, or a masses, those numbers in masses. So those people will have to go a great distance to get that care. So in terms of challenges, we're seeing 50% a decrease in our patient patients coming in to be seen because we were asked not to schedule any preventive care. We're ramping up for telemedicine, and our patients who are technologically challenged would have to be trained on how to use telehealth. They know how to call in on an e-visit, but they don't know how to use a telemedicine visit for the most part, or to download it on their devices, if they have devices, or if they have the access to internet, broadband, those things that will work well at my house 15 miles outside of the city. So I'll stop there and let the next person speak.
Thank you for vital, pertinent information. Certainly you're on the front lines and you're creating our awareness on a lot of these issues, and we're glad that you're here to help us. The next person that we will hear from on our call will be Mr. John Fairman. He is the CEO of the Delta Health Center Incorporated, which is located in Mound Bayou. Mr. Fairman. Having a problem unmuting you for some reason.
Can you hear me now?
Yes, I can hear you now.
Okay.
Thank you. Thank you for joining
I
us.
clicked on unmute on my end.
Okay, thank you.
Well, Madam Chairwoman, Senator Ford, other distinguished members of the Mississippi CBC, let me say, first of all, that the Community Health Center Association of Mississippi and all of its members fairly well speak with one voice. And so in the interest of you all's time, I won't repeat what Ms. Sherman and Ms. Taylor said, except for just a little. Starting by saying that everything that Ms. Aurelia Jones-Taylor just said about her 6-county service area certainly applies to Delta Health Center and the 5 counties we cover. We cover Bolivar, Washington, Sunflower, Sharkey, Issaquena. And so those of you on this call know that that's representative of everything that Ms. Taylor said as well. I would like to point out that as Ms. Sherman referenced earlier, the origin of the Community Health Center movement started in Mississippi. It grew out of the civil rights movement. Now, I dare say that there's probably no one on the phone that did not know that. But just in case there might be one, let me just make that clear. Collectively around the country, the United States and the territories, we see 30 million people. And again, we grew out of the civil rights movement because there was a need to provide care to people that were being brutalized and neglected, and such is the case here. I did appreciate Dr. Dobbs' presentation. It was nice and informative. But the basic problem that we have, yeah, we have supply problems. We have the same issues that Ms. Jones-Taylor mentioned, and you all have all heard about them throughout the nation. Everyone says that the issue should be testing, testing, testing. That's absolutely correct. But we've been charged to be focused with the funds we have on those that are symptomatic. 2 towns in my service area, Cleveland and Indianola, are listed as in the top 10 worst cities per capita in the United States. And so I have been begging for tests so that we could set up a drive-through, was even trying to get some private donations to fund them. Running into the same wall that Ms. Taylor is running into, and that is, where are the tests? Where are the tests? The rapid tests don't use them yet, and all of those other things. Because I wanted to get to the asymptomatic people as well. The ones that are having COVID-19 parties, taking it home and giving it to family members. And I have one of my employees is out as sick as she can be. Been tested, we don't have the results back yet. There's a big problem with turnaround time. They tell you it's going to be 24 to 48 hours, and we're 7 days waiting on the test results. And so if you can, where can you help us? I think you can help us with trying to push that lever to get some tests to us. With all due respect to the hospitals and the references that are made nationally and within the state, and I too used to be a healthcare executive running large hospital systems, the community health centers are on the front lines. If you really want to effectively reach the people of the state, we would get the testing supplies and all of the PPEs to us so that we can deliver care, do both symptomatic and asymptomatic testing. I think with that, Madam Chairwoman, I could go on and on and on, but really we'd be repeating some of the same things that have already been said. Shortage of personal protective equipment, back orders on them, limitations on how many you can order per week or per every 2 or 3 days, and all of those things. We have enough to get us to probably the middle of next week. And we keep ordering every day trying to get there. But the test is what we need to get to the asymptomatic people. Thank you very much. And thanks for having this event.
Thank you, Mr. Fairman. We appreciate your comments. We know where to find you, and certainly we ask you to call upon us so that we can help you in the future. We will move on to our next panelist, Ms. Cindy Lawrence, and this is going to be a different, somewhat of a different issue that she will be presenting to us. Ms. Lawrence is the director for the Lowndes County Emergency Management Department. She's the local EMA director for Lowndes County. So Ms. Lawrence, I'm going to unmute you. I think you're already unmuted. Please proceed. Thank you for joining us today. Well, let's move on to our next participant. She's on the line, but she may be having some technical difficulty. Senator Horhn, are you ready to present to us?
Yes, ma'am, I am.
Okay, we'll let you go on and get started. Thank you for joining us. Let me just introduce you, Senator Horhn. Of course, he's a member of the Mississippi State Senate, and he's also the chair of the Labor Committee, and we've asked him to come and join us in that capacity to present on labor and unemployment issues. Thank you, Senator Horhn.
And thank you, Madam Chair. Some of this will be perhaps redundant because we had a conference call with the head of employment security last week, and she provided a lot of this information to us. The normal routine in terms of unemployment insurance, if you're trying to get unemployment benefits, it's a very convoluted process, first of all. And on top of that, what it generally required was that a person filing a claim for unemployment coverage would have to wait a week before they could apply. And they'd also have to demonstrate evidence that they were making job searches on a regular basis in order to continue to get what they call the WBA, the weekly benefit amount. Under the current state circumstances, you would qualify to receive a weekly benefit as low as $30 a week and maximize at $235 a week for up to 52 weeks. Under the COVID-19 stimulus package, the unemployment insurance was given a pretty hefty amount of money to allow the unemployed to receive additional benefits. Let me back up. The governor did a couple of great things with the state portion or the state operated and normal unemployment benefits by eliminating the 1 week wait before you could apply for your benefits and eliminating the requirement to do a job search. And furthermore, under the stimulus, what the federal government did was to provide an additional $600 per week across the board to any unemployed worker who qualified and was approved through July 31st. So let's say you maxed out and you got the $235 a week from the state program as it normally operates. you would get an additional $600 a week through July 31st. And as I say, it eliminates the the 1 week wait and also the job search requirement. If you lose your state benefits while the pandemic is going on, let's say you lose that $235, then the COVID program allows for you to continue to receive the COVID benefits for an additional 13 weeks past July 31st. When we talked with Ms. Turner, Jackie Turner, who runs the Department of Employment Security last week, she indicated that they were getting 2,500 claims per week, whereas in previous weeks they were getting like 600. And they certainly are very overtaxed by all the claims that are coming in. They've hired an additional 85 people, and they are trying to beef up their online presence. For anyone who wants to share with their constituents how to file a claim, the constituents can do it in one of two ways. They can call a toll-free number, and that toll-free number is 888-844-3577. Once again, 888-844-3577. Now they've hired, as I mentioned, an additional 85 workers in the call centers to take calls and to fill out claims over the phone. But 81% of all the claims that they're doing are coming in online. And there are several ways you can do it. You can just Google COVID-19 unemployment benefits, and it'll take you to a place where you can get your information for your particular state, in this case, Mississippi, and you can start the process. When you get to the Mississippi Department of Employment Security's portal, you want to go to disaster unemployment assistance, and you click on that, and it'll walk you through the filling out of the application. But if you want to go directly to that website where you can start filing through the portal, you can go to MDES, that stands for Mississippi Department of Employment Security, MDES.ms, that is real long, mdes.ms.gov/unemployment claims/information. Now you can understand why a lot of folks are frustrated about dealing with the process of filing the unemployment. Just the link in and of itself is convoluted, but it's worth doing because you can get help, and the $600 a week on top of what the state is providing under normal circumstances is going to hopefully carry a lot of folks through this difficult time we have. Some people may be wondering, well, they said I had to do a job search. Well, you don't have to do a job search, but you may have to go online and check in to verify that you are still unemployed. And then the other question is, do I qualify? If you had a job that has been impacted in any way by the COVID-19 pandemic, then you can file for unemployment benefits, both with the state's regular program and with the $600 a week program. If you got laid off, if you got furloughed, if you can't go because your child care center shut down, if you have two jobs and you lose one, you can still apply for the losses associated with the job where you're laid off. If you can't go to work on the job or the job site's shut down, you can still apply. And I will point out, Madam Chair, that in talking with Ms. Turner last week, we found out that she's Department of Employment Security is getting an additional $3 million for administration to help with getting people hired for call centers, for technical assistance, and so forth. And my understanding is that they're having problems finding folks to meet the needs of their call centers and technical assistance programs. So if members of the Black Caucus have constituents or that they want to recommend or have ideas about how we can skin this cat, Ms. Jackie Turner, I think would love to hear from you. I will just digress a little bit, Madam Chair, and mention something about what Dr. Dobbs was saying. I don't want us to lose sight. We've got the health and well-being and economic vitality of our constituents at stake, but there's a lot of money that's coming through the state of Mississippi. It's in the billions and billions of dollars. And one of the things that I'm seeing as I observe what's going on is we don't see anybody who looks like us who's at the table at a lot of these meetings where these decisions are being made. And particularly, it's been proved that Blacks are suffering at a disproportionately higher amount of through incidences of contraction of the disease. And yet, I don't hear, Dr. Dobbs or the governor or anybody else saying we're going to put a real outreach focus using the Black community's resources to get the word out about the fact that we are particularly vulnerable in this situation. I don't hear Employment Security saying we're contracting with a Black firm to help us with our staffing shortages. And I really do believe that the caucus ought to take an active position with regard to that. That concludes my presentation.
Thank you, Senator Horhn. And I concur with all of the comments that you've made. And this is part of the plan to actually put something together and present it to the governor, to MDES, and all of these other agencies to make sure that African Americans are involved in the process and that we do all that we can to protect our constituents. So we thank you so much for your time this afternoon. Thank you for your comments, and we will go back to Miss Cindy Lawrence. We wish she was still on the call, but I think we have her in the queue now to bring her forward. Just a moment. I can see that she's still on the line. I don't know if she's having an issue with her microphone. Ms. Lawrence. I hate to pass. Mr. Jones, we'll get him in the queue also. Mr. Jones, yes, I can hear you.
Yeah, can you hear me?
Yes, okay, let me introduce you first. Mr. Jones is the chair of the Small Business Capital Fund of Mississippi, and we've invited him to come on and give us a presentation regarding matters of finance, COVID-19, and the African American community. Please proceed, Mr. Jones.
Well, thank you, Madam Chairwoman. I appreciate it, and appreciate you and the Black Caucus and Senator Horhn put on this this conference and this communication, this discourse about the economic side of the House. I'm sure everybody has been probably scrambling and reading from the small business side on the CARES Act that has been passed, which is Coronavirus Aid, Relief, and Economic Security Act, that has been passed by Congress, and the amount of funds that's been put into that act. If all of the healthcare, which is smaller nonprofit business can also apply, have not applied for it, then we encourage a small business to do that. Let me just briefly give an overview because we got a short time, so I won't go into details because all of this information has been flooding the website here. But if anyone would go to the Small Business Administration website and pull down that, just Google COVID-19, all of the financial information will drop down, and all the requirements. But the biggest portion of the act is two major components, but there are several other components that small business need to pay attention to, and the individuals. The largest one that everybody is now seeing come through is the Paycheck Protection Program, the one everybody calling PPP. That's the first major relief of the act that has been put forward, and it's a capital cost to cover the cost of retaining employees. So it's a Paycheck Protection Program, and is therefore to those individuals who have to lay individuals off, but to keep them on and paying that paycheck. The next act is the Emergency Economic Injury Grant, which is a small infusion that small business can get. And then the Small Business Debt Relief Program, also a major component in the SBA bill. Now, all the dollars by the Treasury was put to go through the SBA portals, actually through the banks. So the Paycheck Protection Program loan, Small Business Debt Relief loan, Economic Injury Disaster loans, Emergency Economic Injury grants, in addition to small business counseling and small business contracting with the small business tax provision, all of that has come part of the CARES Act. So I would encourage those who want to take a look at where everything's at from an economic standpoint to dab into all of those. Just real brief and quickly, the PPP, the Payment Protection Program, is the one that everybody is looking at, mostly because it's a cash flow assistance for 100% of federally guaranteed loans to employers. And if the money is used for that, once they receive it, if the money is used for that, then they get to forgive that loan as a grant, which is one of the largest components. The basis of it is to be able to provide to small businesses 2.5 times their average monthly payroll, if you will, plus some additional operational costs that's associated inside of that particular act. On the SBA guidelines, the small business is dictated as less than 500 employees. So, in the state of Mississippi, you cover a whole lot of individuals, a whole lot of small business, a whole lot of small companies. So, that money is applied for through the banks. Now, come Friday, most of the banks put out their own applications. So if you are banking, or your banking relationship, your banking officer, they probably send out their own portal. I know Trustmark had its own portal, Regions had theirs, and Wells Fargo. And you go online and apply, put in the business information and apply. And those loan size can go up to $10 million, depending on, again, the size of the business. That's one of the major portions of the economic piece. The other interesting component is really the economic recovery, the EIDL, the economic injury disaster loans that can be used for forgiving, but also used more on the long-term approach to helping small business recover from this pandemic, from this layoff, because a lot of that funding in the 504 program or the 7A loan program will be needed. Now, that's the act. That's the crux of it. Of course, it's $349 billion that was put in the Paycheck Protection Program for the community. Now, here's where the twist becomes, because we always use the old phrase here: when the majority of the community get a cough or a cold, we get the flu. There's no change here, because what's happening and what's going to continue to happen, unless we can begin to look at this from a depth standpoint, is that the small business that we serve, and the Special Small Business Capital Fund, which is usually a minority capital fund, most people know us by that name, MNCAP, is that the people we serve are non-traditional small businesses, which makes up the majority of small business in this country. Those individuals who are relatively self-employed, got 1 or 2 employees, 3 or 4 employees, and have not been carrying a large payroll, so to speak, but still providing employment to individuals, to provide employment to individuals who may receive a 1099 or just may receive cash payment. They're going to take a major hit, and right now we've already seen the the movement of funds as it moves through larger banks. For example, Bank of America always reported that by the opening of this application, they had received 177,000 applications to a tune of $32.6 billion. Now that's one bank right at 10% of the entitled pool. Wells Fargo said they already at capacity of what has been requested. The majority of small companies with 50 employees is probably going to be hit because ADP survey shows that 90,000 jobs in March was lost by small business alone. We talk about the mom and pops, the grocery stores, the corner stores, and as economics would have it, these guys only have on an average of 15 days of cash coverage, if you will. After 15 days, they would have burned out all their cash trying to maintain their business without a steady flow of revenues coming in. So what's the take? What needs to happen? Well, one of the things that we know the CDFI and Small Business Capital Fund is the CDFI International have gone to Washington trying to help Congress, and then especially the Congressional Black Caucus understand is that, well, the president talking about putting out another $250 billion. That money not only have to go through banks, the traditional means of putting money into the economy, they're going to really have to get that money down to the CDFIs, to the small communities, to the small credit unions, so that where the rubber meets the road, so to speak, where the boots on the ground, in order to reach the masses of small business that may not have that banking relationship to receive the money through the traditional routes. There are companies and groups already is coming together to pool money to figure out how to get their own loan fund so that right there in their community, directly in their community, they can reach the small businesses that really needs this money. And again, I applaud the caucus and Madam Chairwoman for you guys putting this on. Some serious discussions need to be had of how to get money to those off Wall Street down to Main Street. And that's where the reach needs to be. That's where this 200-some billion dollars about to hit, 250 billion additional funds about to hit. This $2 trillion is going to get lost unless something is done to make sure that it comes out of the banks and hit those on Main Street. Again, be short and quick, but that's the economic side, and that's the realization of what we see is going to happen because it's going to be long-term for businesses. It's going to be a long-term approach. A lot of business probably going to get lost in the small communities, and one that we can't afford to continue to lose our economic base by losing our small business. Thank you, Madam Chairwoman, and it's been a pleasure.
Thank you, Mr. Jones. We really appreciate you for joining us and sharing with us this afternoon. We also have Mr. William Bynum, who will present on matters of finance. He is the CEO of Hope Enterprise Corporation, Hope Credit Union, and Hope Policy Institute. Mr. Bynum, are you unmuted?
I am. Can you hear me?
Yes, I can. Thank you for joining us. And I think you may have, do you have some cohorts on the line with you also? Would you like them unmuted?
I do. My colleagues, Diane Standard and Kiad Burt, are on the line from our Policy Institute. So they may want to chime in, but I will get started. And thank you for inviting us to participate. And thank you for organizing this conversation. As you all well know, and I'm sorry I wasn't able to join earlier. There was a lot of attention and demand for the information you're putting out. I got a message that the teleconference was full, and so I wasn't able to get on earlier. But I do want to just share a few words about what we are seeing at Hope Credit Union and at our Policy Institute, and it really builds on what I think we all know existed even before this crisis. You know, we have in Mississippi, we have always been challenged in terms of wealth and opportunity, particularly among communities of color. When you look at Mississippi, over half of Mississippi households just don't have enough cash to survive for 3 months if they lose their income. And if you can look at the racial differential, this is 72% for Black households. 72% of Black households can't cover basic expenses for 3 months. compared to 42% of white households. The coronavirus has exacerbated what was already a bad situation. Now these families are faced with loss of income for indefinite amount of time. And you add that on to already overwhelming burden of medical expenses, education expenses, and the fact that people of color are disproportionately in lower wage jobs that don't have benefits. So the safety net wasn't there. And now this devastating virus pandemic has wiped that safety net away. We're seeing people knock on the doors every day that need loan deferrals. We don't want them to lose their homes, their cars, their means to support their family. And so as Mr. Jones just described, organizations like HOPE and community development and financial institutions, minority depositories, which we really don't have very many here in the state, play a critical role, because when you look at SBA lending before the pandemic, there was a significant gap in terms of Black folks being able to access financing, and that gap is widened dramatically. So what we are seeing at HOPE, we will do 4 times the amount of business loans in the next 6 months that we do in a whole year through these paycheck protection program loans. We are also seeing that, as was mentioned, traditional banks don't go as deep in terms of need, not just in terms of serving communities of color, but the size loans. Many banks have set a floor and don't do loans, but people of color, they need this lifeline more than anyone. And so it's really critical that, sorry, I hope you can hear me. I'm having some problems with my internet.
We can hear you. There was a little space, but yes, we can hear you now.
All right, sorry about any problems. But again, the ability to get resources into organizations, both CDFIs, but nonprofits are critical lifeline organizations. The PPP loans are available to nonprofits. Again, we really need to make sure that those large institutions are held accountable. The Community Reinvestment Act, the Comptroller of Currency, has moved forward with recommendations that would severely damage the requirement for banks to invest in low-income communities. And so I think accountability at this time, particularly when we're seeing the disproportionate impact on people of color, there is I don't think it's a coincidence that 72% of the deaths in Mississippi are African Americans, despite the fact that we're only 36% of the population. When you look at the relationship between health and economic stress, the conditions that people live in when you don't have access to adequate health care in some of the poor communities, this is the disproportionate impact on people of color should not come as a surprise, but policy accountable that the resources that we all contribute as taxpayers are equitably available to communities of color. I'll make one last point, and that is we're seeing an increase in the number of predatory loan scams, taking advantage of vulnerable people, calling and trying to get them to take on these payday debt loans that will get them further into a debt trap. And so, again, the importance of consumer protections, really doing away with payday lending if we can do it, but certainly putting a rate cap in place so they can't charge more than 36% is something that I really encourage legislature and others to consider at this time. So I'll stop there, Madam Chairman.
Thank you, Mr. Bynum, and we thank you for highlighting those issues for us and also giving us as legislators things that we should be diligent and vigilant of and paying a close attention to as we go back into the legislative session. I think we have Ms. Lawrence now who's live, and I believe she's already unmuted at this point. Ms. Lawrence, can you hear me?
I can hear you.
Great, great. So callers or participants, we have Ms. Cindy Lawrence with us, and she's been with us all along. She is the director of the Lowndes County Emergency Management Department, and she's going to be sharing from her perspective in that capacity. Ms. Lawrence, thank you for joining us. You have the mic.
Good afternoon. And I'd like to say thank you to our distinguished guests today, and thank you for inviting me to participate on your panel. On behalf of the local emergency management agency, we work closely with our state agency, Mississippi Emergency Management Agency, under the direction of Mr. Greg Michelle. He has been working diligently with us in getting PPEs into our community. Of course, we are still in dire need of PPEs. We actually help our hospitals and all of our health agencies, along with all our first responders. The issues that we've been seeing a lot now with the COVID-19 is, talking with pastors at churches, social gatherings of more than 10, and with funerals. It's been very difficult working with the churches and the funeral homes because they still don't understand, the need of social distancing and social gathering. When you talk to them, they understand that families want to gather because this is the closure for many families. But at the same time, we'll get them to understand that we're trying to stop the spread of the COVID-19 here in our local area. We work closely with our hospitals, and our hospital do the testing, and we have some of the doctor agencies here that also test. We are working now trying to get a mobile testing site here in Lowndes County. I've been working with our local hospital, Baptist Memorial Hospital, and we're talking maybe within the next 2 to 3 weeks, we should have a mobile site test set up. I still don't understand, why we don't have the capability here where we can test people for free. I know we say call your local physician or call the hospital or go online to the Mississippi Department of Health website. At the same time, when you do that, you still have to pay. So one of the issues that I've been receiving from some of the local citizens here is, where do you go to get free testing? And I am now working with our local health department trying to get the free testing here in Lowndes County. Presently, we have 18 confirmed cases here in Lowndes County. We fortunately don't have any deaths, but we are working diligently with, as I said, with our state agencies, with the Department of Health, and we're working with our citizens here in Lowndes County. The one issue that we've seen within the last couple of weeks, I should say, with the weather changing, is younger people wanting to do the backyard parties, wanting to host the social gatherings, backyard parties and birthday parties. We're still seeing a lot of that. And here we have an executive order where you can only have a gathering of 10 or less people. Therefore, the law enforcement has been authorized to issue citations to those residents who are actually gathered with 10 or more people. As I said, continually we're seeking PPEs. I have placed orders with several vendors, and I'm still on back order trying to get PPEs here in Lowndes County. But fortunately, there was some PPEs in the national stockpile, and we have been afforded some of those supplies here in Lowndes County. As I said, we just issues this with social gatherings. If we can get people to understand that we're trying to stop the spread, and the one way to stop the spread is social gathering. And I do not understand how people are to get PPEs if we can't get PPEs. And I know they talk about everybody should wear the mask. If we as first responders can't get PPEs, and I know that the community will not be able to get PPEs either. So that's why we are really, really stressed. And I really wish that you all could stress through some type of advertisement, letting people know that the one way we can stop the spread is through social gatherings. If we could do the 10 or less and the 6 feet apart from each other, that would really help. And I thank you for inviting me to participate here today.
Thank you, Ms. Lawrence. Your presentation has been most helpful, and it's always good. And I think what I've learned here today is we receive the reports on the news, and we see what's going on nationally. But as Mississippians, as residents of various counties, we have our own individual issues to deal with. There are needs that relate to testing, resources, making sure that families receive adequate help. These are all things that we must be vigilant about, knowledgeable of, and do all that we can to improve those situations. We do hope that you feel as though your time spent with us today has been helpful. Hand washing techniques, practicing social distancing, these are messages that we've heard before. We're going to hear them again, and we need to pass them along to our constituents, our family members and friends, to make sure that we're doing all that we can to protect ourselves. I would like to thank the members of the Technology Committee of the Mississippi Legislative Black Caucus. They've worked along with me. I've worked along with them to put on this, what we call digital dialogue, gathering members of the community and their different fields of expertise to share with us what's going on from their perspective. This won't be the last call. You'll be hearing from us again as we try to create venues and opportunities to provide information and to hear from you. So as we leave our time here today, please stay safe. We hope that you have learned something that will be beneficial to you. Share this information with your friends. And until then, we will make sure that we're working on behalf of you as members of the Mississippi Legislative Black Caucus. Stay safe, and we will now conclude our call. Thank you all for your time with us today.